What are conditioned responses and addiction triggers? Imagine walking into a room and suddenly feeling a strong urge to use a substance, even if you haven't thought about it all day. That's often the power of conditioned responses in addiction triggers. These are reactions your brain has learned over time, linking certain situations or feelings with substance use. When you repeatedly use a drug or alcohol in specific places or with certain people, your brain starts to associate those cues with the act of using. So, just seeing a particular place or feeling a certain emotion can set off cravings or physical reactions, even if you are trying to stay sober. This process is called classical conditioning, which is a basic way we learn associations. For example, if someone always drinks alcohol at a friend's house, their brain begins to connect that environment with drinking. Later, just walking into that house might cause cravings or even physical symptoms like sweating or a racing heart. It's almost like the brain remembers the good feelings or relief associated with substance use and triggers those feelings again. There are three main ways these conditioned responses work in addiction. The first is the conditioned withdrawal model. This suggests that cues linked to withdrawal symptoms, like feeling sick after stopping a drug, can later cause those symptoms to appear even without the drug. The second is the conditioned appetitive motivational model, which says that cues associated with the pleasurable effects of a substance can produce cravings or a desire to use. The third is the conditioned compensatory response model. This one explains that cues can trigger bodily reactions opposite to the drug's effects, which can lead to needing more of the substance to get the same feeling. These conditioned responses are not just mental, they involve changes in the brain's reward and memory systems. That's why triggers can cause such strong cravings and make relapse more likely. External triggers can be places, people, or even emotional states like stress or sadness. Internal triggers are feelings or thoughts that reminded someone of substance use. Recognizing these triggers is a key part of recovery. Treatment often focuses on helping people understand and manage these responses. Strategies include avoiding known triggers, creating new routines, and learning ways to cope with cravings. Therapy like cognitive behavioral therapy helps break the link between the trigger and the response. It teaches individuals to respond differently when faced with these cues. Knowing about conditioned responses helps explain why staying sober can be so challenging even after a long time. It also shows how important it is to address both the physical and mental parts of addiction. By understanding how these learned reactions work, people can better prepare themselves to handle triggers and stay on the path to recovery.